Dr. Jill,
Yes.
talk to us about our responsibility to our own bodies regarding this issue.
Well, the first thing is, I think Dr. Copeland said that we definitely need to be screened. You need to go and get your mammogram. And that's one of the things that I say to women often. Make sure that you take care of yourself when you're taking care of everybody else.
Absolutely.
Schedule that mammogram. I let mine go this year in past time, and it was my assistant who said, I will schedule for you. And so if you know someone and they are too busy,
Yes.
you can always do that for them. Say, you know, girlfriend, do you need me to schedule that for you?
Yes.
Do you need me to go with you?
Yes.
Because you are afraid. That's the first thing. The second thing is, you know, there have been guidelines continue to change. Last November, there was a big deal where the guidelines changed. And so there was
Talk to me, what do you mean?
the guidelines as to when you need to be screened.
You mean the age?
The age.
Talk to me.
So what happened? What happened was there was a big controversy among doctors because the guidelines changed, saying that women under the age of 40 did not need to be screened. That you needed to start at age 50 and from 50 to 74, not yearly, but every other year. And so what I have said to my patients is this: particularly if you are one of the groups who has more virulent forms of cancer, more aggressive forms of cancer, you need to get your mammogram even if you have to pay for it yourself.
Absolutely, absolutely.
So-
What about your family history? How involved is that, though?
Family history is important, but most people don't know that only about 10% of breast cancers are connected to the gene. So only about 10% have a family history of breast cancer. 90% of women have no family history. And so a lot of people think that because I don't have family history, then I'm free and clear.
Yes.
And that is not the case. There are lots of things that are risk factors that go into your increasing your risk for breast cancer. And so you want to make sure that you are screened. There are even places now where if you have no resources, if you don't have the money, you can't afford it, there are actually places where you can go and get a mammogram at no cost to you.
Very
Yes.
good, very good.
Yes.
So what are some of the indicators or signs, even after you've done your exams,
Right.
but you still feel a little bit, what?
Right. Some women will say they just don't feel good. They feel fatigued. Some women have breast pain. I have a patient who was diagnosed, like Dr. Copeland, in her 30s, and it was just she had this ongoing pain. Anytime you see any change in the outside of the breast, for instance, if you see dimpling on the surface of the breast, or if you notice that the nipple has now inverted, those are things that you want to make sure that you go and have evaluated. The other thing is this. A lot of women say, well, I just have lumpy breasts. So I can't tell if it's a new lump. The reason you want to do your self-exam on a regular basis is so you will know when the lumps change.
Absolutely.
So you are not expected to diagnose yourself. But if you know that this was not here last month, or this is something different, or the texture has changed, you need to make sure you go to your medical person and talk to them about it.
Okay, one of the things, this is Girl Talk, right? Okay, so we're talking seriously about our bodies. We're not going to shout all week. We're going to address some things that are really, really taking over us as women, and we're dancing in the pews and we're dying unnecessarily just because we don't take heed to our bodies. It's been facts say that Caucasian women are diagnosed more, but African American women actually have the larger. What's going on there?
Some of that, initially we thought it was just because African American women aren't screened. You know, and so because fewer of us were getting screened, but as we've looked at this issue closer, it appears that we get more aggressive forms of cancer. And so when we are diagnosed, often, just like Dr. Copeland said, we are diagnosed with very aggressive forms of cancer. So it's really, really important that you find that cancer early.
Yes.
When it has not infiltrated, when it has not spread, that's very, very important. And some people think it has to do with our diet and some other exposures that we may have that other populations don't.
That diet piece. We'll talk about that in a little bit.
Yes.
You know that I've also noticed that we're waiting later as women to have children.
Yes.
Talk to us a little bit about some of those issues, you know, that we should be concerned about regarding that.
Well, I was one of those women who waited until later to have children. I had my second child at the age of 42. But a lot of women are waiting late because now, you know, we have careers and some of us just choose to wait. In terms of overall health, there are some issues, you know, some increased risk for some birth defects and those kinds of things. But a lot of women find that as they get older, they have problems with fertility.
Yes.
So they can't get pregnant. Some of that has to do with you have a set number of eggs. You are born with a set number. When those are gone, that's it. And so, oh, well, that's it.
Oh, well.
And so, but that's
Right? It's girl talk.
That's variable.
Yes.
For other women, they may have some issues. Stress, we know, will decrease your fertility. Some women may have scarring. The other thing that I think also has to be mentioned is we always think of the woman when a couple cannot conceive. We always think, well, there must be something wrong with the woman. We now know that the man also needs to be evaluated. So when you are going through that, you want to make sure, in addition to the woman being evaluated to make sure that she's fertile, that the husband also needs to be evaluated as well.
Okay, so what are some of the options for women that are having fertility issues, diagnosed fertility issues?
Well, the first thing, you want to try to get pregnant. We tell women, if you are under the age of 35, you at least want to try for a year. If you're older than 35, then after you've tried for 6 months, it's time to do the fertility testing. You start with your primary care physician. So that is the person who can check you for things like thyroid disorders, you know, or to make sure to do a sonogram, those kinds of things to make sure that just the plumbing is in place.
Yes.
So once you do that, yes, once you do that and you make sure that everything's okay, if you don't find the reason or something that you can treat, then you go to a fertility specialist. And there are lots of fertility specialists out there, and there are many, many options available for women.
Well, Dr. Jill, thank you for sharing your loveliness with us and your expertise. I love you.
I love you back.
Some nuggets that we got from our first two special guests. Don't confuse fantasy with... Wow, they're listening, First Lady. Don't confuse your faith with denial. That's right. And these are things you can act on. Get your mammogram. Even if you have to... Well, don't we hate to pay? But you get your mammogram even if you have to... And get checked, even if you have to pay for yourself, and the guidelines. She mentioned guidelines, get your mammogram, and some girl talk here. If you have dimples or inverted nipples, no, thank you. You were listening. Make sure you get checked. And then also, what is very important, every woman in this congregation do today, when you go and take your shower,
Self-exam.
Self-exam. You're gonna do it when?
Every day.
Tonight? Tomorrow?
Yes.
You're gonna do your what in the shower?
Self-exam.
Oh, right. Are you ready for your next guest?
We are.
We're going to introduce to you Rosalyn Houston. She is the Executive Vice President for Compass Bank and has over 20 years of experience in the banking industry. She holds a BS degree in Organizational Management. Rosalyn Houston currently resides in California with her husband Ronald and